Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems Better Care podcast. I'm here today with Dr. Carolina Sueldo. She is a double board certified reproductive endocrinologist and founder of Ceibo Fertility Center, where she's dedicated to guiding patients through personalized paths to parenthood. Thank you for joining us today.
Absolutely. Honored to be here, John.
Yeah. And I think you're our first fertility specialist on the podcast. So this is going to
Really?
be
Okay.
very
Awesome.
insightful for our audience. And just before we dive in to all the questions, to give our listeners the backstory, how did you get here and what are you building right now?
Yeah. So I finished my fellowship training in 2015. So I've been practicing for about a decade now. And this is my third position out of fellowship. And I think coming out of fellowship, I really had no clue about what the different types of models were for care or within the medical system, working for hospitals versus working for a private practice group versus starting something yourself. So my very first position out of training was with a large group in the South Florida region, and they were partially physician owned, but largely private equity owned. And then my second position was out in California, my hometown of Fresno, California. So props, shout out to anyone from Fresno. And that's a purely physician owned practice. And then most recently moved back to the South Florida area and, decided to hang the proverbial shingle. I gave myself a year and started to build the plane as I was flying. So Ceibo Fertility is located in North Fort Lauderdale, Florida. And really, like the whole vision around starting it was sort of this fundamental mission of bringing the experience back to the patient-doctor relationship. And I think that's really gotten lost in today's medicine. And, in looking at what was out there and what was available for me as a provider, I had so many years left of medicine to practice. And I really wanted to do it my way. I wanted to see if I could do it my way. Right. And I'll tell you, when I was thinking about opening Ceibo, it was very much like, you're crazy. It's never going to work. Doctors don't start practices anymore. Specifically in the fertility space, the lift is too heavy, the operational costs are too high. And essentially, it was expected that I was going to fail. And then here we are, we just turned 2, we're growing, and we're now thinking about Ceibo 2.0, I call it Ceibo version 2.0. And yeah, just, really, really excited for what's going on down here.
Yeah, it sounds like you're growing very quickly. And a lot of people who are just starting a business, I'm sure, get that from even family and friends, is like they're expecting you to fail and not always supportive, unfortunately. So it's glad to see that you're defying those odds and, thriving, obviously. So, and then
Yeah, and it's scary, don't get me wrong. I mean, when all the external messaging is don't do it, there's definitely this like, ooh, should I, shouldn't I? And those first, those first months, particularly the first 6 months, it was rough. Like, I'm not going to sugarcoat it. It was definitely tough, but it was somewhere around month 6, 7 that things kind of started to turn the corner, and you could see, like, I don't want to say the bright light, but like this faint little glimmer that something
some
was
hope
starting to
and
happen.
feeling better.
And starting to turn things around. So yeah, it's exciting. Exciting to see where we're at today.
Yeah, and there's a lot of fertility specialists out there today. Thinking about solutions you provide. What makes you unique in your space right now?
I mean, I think a couple things. I think specific to the fertility space, there's just, in terms of physician-owned, physician-started practices, there's just not a lot. Like, it's. I think we're starting to see more, but particularly during the pandemic, there was a lot of consolidation that occurred in our space, and groups joined together. Private equity entered the field. Big hospitals or big networks, also entered the field. So I think one of the unique things is, because you are physician owned, because you have this independence, like at the end of the day, your priority and your responsibility is to your patients. And you do what's best for them and what's right by them. You're not thinking about investors. You're not thinking about, how many IVF cycles I have to get done, or, what the volume is, and sort of what is the growth pace to be able to turn around and sell, et cetera. So really, I think the patient doctor connection and that relationship, particularly in a field like fertility, that is so vulnerable, that there is so much that's, intimate and really so much guilt and shame around the diagnosis. And we have great data. We have data from the New England area that shows that if patients are well supported by their clinic, by their team, that they are more likely to stay in treatment and they're more likely to be successful. So I think that's probably our biggest differentiator. We are a small boutique practice, right? And I always tell people, I'm not going to be the right doctor for every patient, but I'm going to be the right doctor for my patients. So for somebody who is looking for something large and super high tech and super modern, we are really looking to provide really excellent care and really good medicine and pair that with a very homey, warm, and welcoming experience.
And do you mind kind of expanding more upon, you already mentioned a little bit, difference between like a physician-owned practice versus like maybe investors that are getting involved in the practice as well? What does that dichotomy look like when you're comparing those two?
Yeah, I mean, I think, and listen, I'm going to speak. This is my opinions and my opinions only. So,
Yeah.
take it for what it's worth. But I think at the end of the day, when you have a physician-owned practice where the physicians are the ones driving the decision making, I think that at the end of the day, the team has a better experience. So the clinical team, and I think the patients have a better experience. Now, I will say in today's healthcare space, there's a lot of reasons why that is tough, particularly as we continue to see insurance reimbursements decline, making it harder and harder for those profit margins to make sense. But at the end of the day, it's about what's the bottom line, right? What's the priority? And when the priority is to the patient, I think everybody wins.
Yeah. And sounds like that's part of the consideration if when a physician is deciding which way to go when starting the practice on their own, or they want to get some investors involved in the process. It maybe depends on how at risk, right? How much risk do you
Yeah,
want
and
to
I
take?
think exactly. And I think there's a lot of variables to consider. Like if you had asked me 2 years ago, I was extremely galvanized in my mission and sort of like down with investors and everybody should own their practice and, very, very passionate about it. And I think now, 2 years later, with everything that I have learned, I can understand why someone would want to bring in outside partners. I can understand where that would fit into the model. But I really think it's about the pros and cons. I think, a lot of it is where you're at in your physician journey. If you're an early career physician, like I personally, I'll speak for myself, I could never have imagined starting this right out of training. I think that there's so much there where you're still sort of getting your clinical chops, if you will. You're still getting your solid footing from a clinical standpoint. And there's so much to learn of the business of medicine, right? Because for most physicians, seeing the patient, that's the fun part, right? Taking care of patients is what we love. That's what we all went into it for. But as a practice owner, there's sort of this whole other side of managing your people, managing all the HR stuff, PTO, benefits, the overhead, vendor contracts, where you're getting your supplies, who you're using for your blood work, so many other considerations that go above and beyond the patient care. And so not everybody wants to have that responsibility, right? It's a lot of pressure. There need to be hours in your week dedicated to doing that if you want to move the practice forward. And so there's a lot to consider, particularly, another factor would be if you've already got your board certification versus you're still needing cases to build for board certification. There's just a lot of consideration. So I definitely think this is the right model for me, for my stage of career, for where I'm at. And I'm excited to see Ceibo grow. But I definitely don't think it's black and white. And I think that if I could sort of pay it forward, one of the things that I would love to educate trainees, so whether it's residents or fellows, one thing I would love to educate around is like, what are those options and what are the pros and cons, right? And I'll speak specifically to the fertility space. There's definitely very important considerations when you are looking at a larger group, a larger practice versus a sort of smaller, independent practice that are worth considering when you're making that decision.
Yeah, it sounds like there's a lot of factors in there as well.
Mhm.
And what's a belief, that shaped how you work today? Is there something like in your core that made you basically make that switch to get going to physician-owned practice?
So it was really important to me when I was looking at starting Ceibo and I had to make a decision around how the practice model was going to look, right? Because it's a blank canvas. I get to sort of decide what that's going to look like. I had a business coach who said to me, look, you can either do high ticket and low volume. And in that scenario, you probably can't accept insurance because insurance reimbursements have gotten so low that you have to run a high volume clinic. So if you're going to accept insurance, that's great and that's wonderful, but you need to understand that it's going to be a high volume model. And so that was really helpful to me. And in a perfect world, I truly believe in reproductive access for all, reproductive rights for all. I would love to see IVF covered at 100% for the entire US population. But that is not the reality of the system that we live in. And so, given the current conditions and given the current climate, I had to make a decision around what that model was going to be for me. And one of the factors was identifying like what's my zone of genius? Where do I shine the most, and where do I fall in love with medicine, right? And for me, that's the patient connection. I still have patients from my first year in practice that's 10 years later, and they're still in contact with me, still sending me updates about their children and things like that. It's a really, really beautiful, special connection that you don't really get in many fields of medicine. And so I knew that that patient connection was going to be so important to how I delivered care and how Ceibo was going to differentiate itself from other clinics in the area. And so because of that, I decided to go out of network, and I opted out of insurance and really intentionally designed the practice to be constructed in such a way that I could spend that time, right? So my average consultation is about 60 minutes. I'm answering portal messages. I'm, along with my team. I'm calling back patients along with my team. If they have an ultrasound with my technician, I'll, pop in and say hi. So it allows me to have the type of, or to practice the type of medicine that I always envisioned for myself.
Yes, you can shape it to make it around your life, I'm sure, as well as like what makes you happy, what fulfills you as you're working with your
Absolutely. I
patients.
think, something you touched on just there is talking about physician autonomy and the ability to create my own schedule, the ability to, how many patients I see in a day, the ability to make decisions around the patient experience. If there's something that's not working or if there's a team member that's having some issues, that physician autonomy is super important. I think when they do a lot of the literature around burnout, that's one of the most common reasons for burnout is loss of that autonomy, right? And not having control over the number of patients that you see. I was speaking to a physician the other day, and one of the reasons that she left her hospital-based position is she walked into clinic one morning and she had 3 8 o'clock patients booked, and all 3 had shown up. And she's like, "Well, how am I supposed to dedicate any time to these patients if all 3 of them?" And then that just starts you behind for the rest of the day, right? So I'm not saying it's good or bad. I think every person has to make a decision. I have a really dear friend who, her mission and her passion is to serve an underserved community here in the South Florida area. And so she does accept insurance. She does have a high volume practice. She is still profitable. She's able to run a successful practice in an insurance-based model, but the model is different. And you coming out of training, you just need to understand what you're getting yourself into.
Yeah, you're talking about residency specifically. Is that what you're referring to?
Yeah, I
Yeah.
think, and I will say, at least, in the conversations that I've had recently, the infertility fellows are much more educated about the different models than I ever was, which is amazing. And I'm so happy to see that. But I think there's a lot of lack of information. Like we just don't know, especially when you're coming through residency specifically and you're working those 80, plus hours and you're just in survival mode trying to get through your case log and then your written boards and then your oral boards and such and such. The hospital model or sort of the employed academic model is really the only model that you've been exposed to unless you've been fortunate enough to have electives or things outside of a hospital-based setting. So I think for a lot of physicians, they just don't know what options are out there. I'll speak for myself. I certainly didn't. I was very naive to the different contracts, the different setups, the different structures, et cetera.
And where resources did you end up finding or people collaborating with to help you in your journey to learn more about the things you didn't know about, especially on the business end? Are there resources that the audience could reach out to if they're interested?
So as I was coming up, I was searching through different Facebook groups that were physician based that might have exposure to different tools, different resources. And through sort of that network, I stumbled upon Entree MD. The founder of Entree MD is Dr. Una. She has a podcast. So if you want to check out Entree MD podcast, and she has a Facebook group as well. But she has a business coaching program that is specific for physicians. And
Excellent.
that's really where I learned sort of the business side of medicine. So, a non-traditional MBA, if you will.
Yeah.
But it was worth every single penny for me. And she's still a mentor and a friend. And I'm so grateful to her for everything that she taught me. And that was really my first exposure to something different. And then as Ceibo was sort of becoming this reality, it was really other female physician founders in the space that supported me through that journey. There's a few that I can name specifically, but Dr. Amy Vazadeh, the Egg Whisperer, she also has a podcast. She's amazing. She's a personal friend and a big supporter of Ceibo. Dr. Natalie Crawford as well from Fort Fertility. And I could name so many others. There's kind of a whole network of us that are independent physician-owned practices that really are going against the grain, if you will, and offering up a different model for what's out there in the fertility space. And I leaned heavily on them. I leaned very heavily in the beginning. I definitely did not do this alone. This was very much a sort of joint and combo effort from everyone. And I'm forever grateful for their support, because without them, the journey is isolating enough, especially if you're a
Yes.
solo founder. And so having those resources to lean into was really important. And then the last one I think I'll mention is, once Ceibo was sort of off the ground, we were about 5-6 months into our practice, I connected with my brother, Matthias Sueldo, but on a professional level, right? And this was like dinner table conversation. This is what's going on, this and that. And he happened to be in South Florida for a little while. And he said, well, let me just take a look at your stuff and I can kind of help you. And what started as sort of this, let me just kind of take a peek and whatnot, really turned into a formal relationship as a strategic advisor for the business. And his biggest role for me has been in formalizing the structure of the business so he's an outside consultant, but formalizing the structure of the business and really sort of more visionary thinking about, okay, this is what you're starting with. This is great. This is what we need to like tighten up and get our systems and processes and all that good stuff. But where are we going? Like, where is Ceibo going? And particularly as things have grown, and thank God, we've been successful and we're growing, you now get approached by other groups, or you get approached by outside investors, or you get approached by all these different opportunities. And as a physician with no business training, it's like, how do you distinguish, right? What's a good opportunity? What's a bad opportunity? And so having that resource and having his support as an outside consultant has been frankly invaluable as we think about Ceibo 2.0.
Yeah, it's an amazing resource to have, and confidant, and ask
Yeah.
questions, and like you said, just take a peek and see what you can do, and help
Yeah.
provide advice in any shape
Yeah.
or form. And it's good to have that validation, like you said, even from Facebook groups, wherever you can find it, a good community to encourage you through the process. Yes, this is a normal pain, like you've said. Within the first 6 months, is probably pretty normal to have the most pain as you're growing. And then there's at some point a transition phase where you're like, I can breathe a little bit, right?
Yeah.
As you get
Yeah,
into it.
absolutely.
So
And I think especially for physicians, we are typically high achievers, right? We're typically
yes,
not used to
not used to
there's
failing.
Yes, yes. And so that beginning stage is really, so I think management of expectations too. It's really helpful to have someone like him, Matthias, coming from the business world and saying, like, totally normalizing the experience, right? And like, you don't have to be 6 months in making a six-figure salary. Like, the fact that by the end of year one, you were able to pay yourself back your startup costs, because I self-funded the start of Sabo, and you were able to pay yourself a six-figure salary, like, you're doing more than all right for year one of business. Like, this is great. And just having that constant feedback loop was very, very helpful in those, well, and even now, but in the beginning, most definitely.
Yeah.
The other thing I would say too is there is a little bit of this herd mentality that happens in medicine where, well, no one's doing it, so I'm not going to do it. Or the opposite, like, everybody's doing it, so I should be doing, XYZ.
Extremes.
Correct, correct. And, I was speaking with a fellow recently, and I said, look, you know, there is a bigger need for fertility specialists currently out there than available fellows that are graduating. So you are not going to want for a job. Like, my recommendation to you is take your time, really get to know the different practices, really get to understand what your role is going to be within that structure. And if you make a decision in your third year, if you make a decision in the second half of your third year, which is the end of fellowship for us, like, that's still okay. You are still going to have a job. It is still going to be okay. Like, you don't have to sign a contract in a rush tomorrow because the market, because everyone else is doing it. And so there's a little bit of that, and sort of doing something that's not the norm can definitely be scary in medicine. So I would just encourage, for those who are looking, to take your time because in the end, that will result in a better outcome for you.
Yeah, we're gonna have patience. I don't know, like you said, difficult, easy to say, but difficult to implement
Yes.
as you're going through that process. So
Yeah.
yeah, and just thinking more about the industry itself and the market that's going on right now. Acetaminophen in pregnancy is a huge topic. I'm
Yeah.
curious to get your input on that and your feedback.
Yeah, I mean, I think here's the thing. Anytime we're talking about any medication in pregnancy, first of all, everyone's always going to be cautious, right? The second thing is no pregnant woman is going to just take something just because, right?
Yeah,
So,
you need information.
correct, correct. And so I think that in a patient who is having pain for X reason, or maybe she's having a fever, taking the acetaminophen is more beneficial than experiencing the side effects or the adverse effects that come along with a high fever or with severe pain. When you look at all of the professional medical societies, the American College of OB-GYN, the Society for Maternal Fetal Medicine, I mean, you name it, all the professional medical societies all recommend that acetaminophen be used when indicated, right? That's the caveat. Like we're not going to give okay, you didn't have dessert tonight, take Tylenol instead of dessert. Like no one is giving Tylenol like it's candy or like it's a prenatal vitamin that you should take every day. Um, but I do think that it is safe and effective medication for women who are pregnant. And I would just encourage any patient who is concerned or who is wanting more information to look at any of the professional medical societies. We can list a few in the show notes if needed, but most of them now have Instagram, social media, Facebook accounts, etc. And all of them have unanimously come out in support of its use when needed in pregnant women.
Yeah. Well, thank you for your feedback on that. I just was interested to get your take on it.
Sure.
Another kind of a market question, if you had to bet on one myth that's going on right now to collapse in the next 5 years with fertility, is there anything specific in your mind that you think would just disappear eventually, or you hope to disappear with more education?
So I think there's a couple different things. I think from a business standpoint or from a business of medicine standpoint, I think the biggest myth in the last 5 years, so pretty much since the pandemic, is that the existence of the private practice model is dead and that consolidation is the only path forward. And I think that, I think that we're disproving that. And I think that more and more you're seeing physician owned practices come back to the fertility space and be successful and thrive. So from a business of medicine, that would probably be my biggest. I don't think that the large groups or the consolidated networks are going away, but I do think that this myth that they're going to take over everything and that there's not going to be any independent physicians left is just simply not true. And then from a fertility standpoint, so actually looking at a fertility and patient education, I think there are probably two big myths that I typically debunk when I am on social media educating. And the first one is birth control pills cause my infertility. So I was on birth control for 10 years. I came off to start my family and I'm now unable to get pregnant. So it must have been the pill that did this to me. And so my answer generally to patients with that is that if you dig deep enough, the birth control pill usually in those scenarios was started for painful periods, irregular cycles. There was some underlying condition so that when you take the birth control pill away, the body reverts back to that baseline condition. So it's not the birth control pill that caused the infertility, is that there was an underlying issue that is now triggering or is now sort of responsible for the subfertility. And then the second myth that I think is worth discussing is that if you see a fertility specialist, that you are absolutely committed to IVF. Basically, if I'm going to go to this fertility clinic, that means I'm doing IVF. And I think that is a huge misconception. There is a reason that our fellowship is 3 years and that we do so much extra training beyond the general OB-GYN. And I'm lucky to be friends with some fantastic general OB-GYNs. But when it comes to specific hormone reproductive disorders, there is nothing wrong with seeing a fertility specialist, having an evaluation, having testing with or without the fertility treatment piece. But there is a reason, like we are supposed to be specialists in hormone disorders, right? And infertility disorders. And so the hope is that patients would seek out that care sooner. I can't tell you how many times there's patients who come after 2 years, 4 years. I think, some have even more. And it's because of this misconception that if they were going to see me, it was because they were automatically committed to IVF. So those are probably the two biggest myths that I debunk when I'm educating online. And then one exciting frontier that I love to talk about with patients these days is, when I was coming through my training, there was a very established paradigm that women are born with all the eggs they're going to have, and they lose those eggs as they get older. So I always envision sort of this funnel of fertility decline in egg quantity and egg quality as the woman ages. We all know sort of 35 and over is considered advanced maternal age, and the decline is even faster after age 40. And that paradigm has always been true. And in fact, today it still is true. But for the first time, at least in my career, in the last, let's say, 3-4 years, we're starting to see challenges to that paradigm. We're starting to see experimental treatments coming mostly from the longevity community that are challenging, like that paradigm. And can we actually change that? Can we actually slow or reverse the ovarian aging process to keep women fertile longer, producing hormones longer, and nothing that's ready for prime time yet, but there's a lot of exciting work out there that's being done. And I think that in my lifetime, we will see that paradigm change. So that's one of the things that I'm most excited about currently exploring.
And I'm also curious too, do you work with, partners as well for like men, especially? Do you work with, the male? Maybe there's an issue with the male in the partnership, or I'm just curious, what does that look like as well? Because I think everyone, they think fertility, they always think a woman, but the male is obviously the other aspect of that too.
I'm so glad that you asked that question, because I always say that the guys are like the forgotten ones in the fertility journey. And we know the data shows that infertility does not discriminate, that it affects men and women equally. It affects across all socioeconomic classes and across all ethnic racial groups. And what we find is that a lot of times the woman has done, the million and one tests, and she's gone through all of this poking and prodding. And really the semen analysis a lot of times is the last test to be done. And so what I would just encourage, or sort of one message that I would send to the audience, is that if there is a male partner involved, the semen analysis should be one of the first tests that's done, because it's non-invasive, it's very easy to do, it's relatively low cost if it's not covered by insurance, and it discards almost half of fertility cases, right? So it's definitely one of the things that is vital as part of an infertility evaluation when you are checking a heterosexual couple.
Thank you for sharing that insight, and getting in kind of like the other questions as well. So what's an uncomfortable truth about your industry that no one wants to say out loud? Is there anything out like that maybe is at the back of your mind? Maybe you read something that's always there, but no one's actually like saying it out loud. I'm just curious if anything comes up to Brian.
So I think one thing that I would say is that infertility is a lot more common than people think. When I was in training, we used to quote 1 in 8 couples suffered from infertility. A couple years ago, the WHO actually came out and said 1 in 6 people were worldwide.
Wow.
If you look at the
That's high.
CDC stats, if you look at the CDC stats for the US, it's actually 1 in 5. So it's a lot more common than people think. If you think about your closest group of friends, 6 friends, one of you is going through that journey. When you look at female physicians specifically, there was a study done on female surgeons, 1 in 4 suffer from infertility and subfertility. So I think it's a lot more common than people think. I think there's a combination of factors for that. One, which is the one that a lot of people talk about, which is that women are delaying their maternity more and more as they are out there developing their careers or, doing other things. And there's sort of this misconception that I'm going to sort of wait to do all these things, and then once I'm ready and stable and all this, then I can start thinking about a family. And maybe by the age of 41, 42, 43, things look a lot different than they did 10 years prior. But I think there's also very much a reality about environmental toxins. I mean, just in the last year, we've been able to document microplastics both in sperm and in eggs, and we know that that is a real thing. So we don't fully understand the impact of those environmental toxins. And in post-industrial revolution, we are exposed to more toxins than ever before in human history. So I think that there's a combination of factors. And I think it's not sort of an easy black and white answer, but I definitely think it's a lot more common than people know. There's still a lot of stigma around infertility. So it's just, it's more talked about, which is great, but it's still not as talked about as other conditions.
Do you think that possibly stress could be part of it as well? Maybe like how our society is kind of growing more dependent on technology, like alerts, fatigue,
For
over
sure.
communication is maybe a way it is described. I'm always curious too.
Yeah, so I think, for those of us who have been in practice for a while, I think we all would universally agree that there is a component of stress and anxiety that is playing a role. The difficulty with that is how do you quantify it? How do
Yeah.
you apply that to the outcomes in a randomized controlled trial and double-blinded study, et cetera. So I think there's some difficulty around obtaining the data, but absolutely. I mean, there's a study that's been published in the reproductive psychology literature where they looked at women who were going through the IVF process and going through the egg retrieval procedure. But one group was infertility patients that were suffering from subfertility and fertility. The other group were egg donors. So they had no fertility issues. They were simply donating eggs for other families. And the cortisol levels between the two were like dramatically different
Wow.
between one group and
Interesting.
the other.
Yeah.
And so even though they were exposed to the same conditions, the same interventions, just the baseline reason of why they were doing the procedure showed a significant difference. So I do think that there's something there. I think it's really tough to quantify. The question that you asked, which is, does stress cause infertility? I think that's a little bit of a harder question to answer.
Answer. Yeah. And then now, because we're on a systems podcast, getting more in like operations and business,
Sure.
what's, and I know you've been only been up kind of short term, a couple years, but what part of your business works, but only because of like, I call it like duct tape or heroic effort. Like it's like a struggle. Yeah. It's always there, but you haven't been able to figure
Sure,
out yet.
sure. Oh, so much. So I think, part of the reason and that I'm so grateful to Matthias and part of the reason that he came on board initially was to take everything that was living in my email nebulous and like actually formalize the business, right? And so we created an HR folder. Every employee has an HR file. We created an SOP folder that now has standard operating procedures for different systems within the business, the articles of incorporation and all the legal documents and whatnot. So instead of living somewhere in my email that now has like a place, we also incorporated a project management tool. So we personally use Asana, but there's many out there. And now we have what we call a battle rhythm in terms of the meetings, how often we're meeting with the team, how often we're meeting as leadership, and sort of what those meetings entail. And so all of that has provided a structure and formality that allows me specifically as the business owner to allocate time to work on the business. So one of the struggles that I have, and I think this is true for every physician owner, is when do I do all of the things, right? Because I have the physician hat where I'm seeing the patients and doing the clinical care. I have the business owner hat where I'm actually working on the business, doing payroll, meeting with a vendor to discuss K options, what is the most recent things, cybersecurity, and like interviewing those vendors to see who we're going to bring in to kind of beef up the cybersecurity piece, et cetera. So all of these things, like when do I find time for that? And how do I go about them in a systematic way versus just, oh, this person I met at the Chamber of Commerce and they look good, so let's just like do something, right? So he has been really strategic in helping me do that. I will say the two hats of in the business and on the business in year 2 is probably what I have struggled with the most.
Yeah, I hear that as a common explanation as well. You're trying to flip the switch. It's hard to do, especially in the course of your day. So you almost have to dedicate time specifically in your week or on your calendar and put it down. So then you're switching at that time mentally to get that focus. So
That's right.
uh,
That's right. Yeah. And the way I have it now is that I see patients 4 days a week. And then I use that 5th day, there's at least half a day that's dedicated to working on the business.
another question I had about, because AI is always a huge topic,
Mhm.
what does that look like in the fertility space? Like, how do you conceptualize
Yeah.
that and how do you actually apply that so it's helpful?
No, that's great. There's so many tools out there right now that are amazing and incredible. For physicians specifically, there are now tools around to help chart. So like an AI scribe that allows you to have it turned on while you're doing a meeting with the patient. And then it facilitates sort of the note documentation. An AI assistant on the website, right, that can help sort of navigate the patient in terms of what might be an interested new patient to answer questions that might prompt them to then call the office to book an appointment, AI assistants that can actually go through emails and like sort those and whatnot. So there's a lot of different options. I think for us right now, we're probably not using AI as much as we would like, but I think that's on the horizon. I think we've started to incorporate some of that. Always the concern is around, privacy and HIPAA and sort of one more thing that we now have to be checking and worried about and whatnot. So we want to be very intentional in how we incorporate that. What's super exciting from the fertility side or from the IVF side is there's a lot of things being explored now in the use of AI and the IVF laboratory, whether it's a sperm selection, whether it's watching embryo development to then select embryos, whether it's an actual AI powered machine that can then actually inseminate and whatnot. So there's a lot of really fascinating stuff that's happening. Most of them are in studies right now. So most of them are not being used for sort of a day-to-day standard of care.
Yeah, that makes sense. And I feel like it'd be really difficult to implement like an AI system, AI caller system or something, especially in fertility, because it's not going to be that personalized care that people are expecting. It's still, people want that phone call. They want to be able to speak to their physician or the nurse who may be on the other line to answer those
Yeah, and
questions.
I think
So,
especially here at Ceibo, for us as a boutique practice, it's something we've thought a lot about because, part of our whole experience is that you're talking to a real person, right?
yeah, real
Um,
person. Yeah.
so, so we definitely think there's a role there. I think we're still trying to work through how it integrates into our particular, practice.
Yeah. Um, you know, this is like a vision. These are vision questions now we're kind of hopping
Okay,
into. So we're
okay.
going there. So imagine right now that your boldest idea actually worked. How would that change the way your business, shows up in the world? It's a big
Yeah.
question, but
It's a
I want
big
to see what
question,
your thoughts
and
are.
it's great because it's a question I've thought a lot about this year. When I first opened Sabo, I really literally the vision in my brain was I just want my little corner of the world where I can just see my
Yeah.
patients and just do
Do
my
your
thing.
thing. Yeah.
Right. And what the last 2 years have shown is like this is something that's needed and it's a model that can work. And so
Yeah.
now what does that look like, right? So if you ask me my sort of big audacious goal, if you will, is that Ceibo Fertility Center becomes a big player in the space, that we scale in a thoughtful way that doesn't compromise the patient experience, that doesn't compromise the team, and that allows patients an option of care to what's currently out there. So I don't think, particularly being out of network, I don't think we'll ever replace the insurance system, right? And so for patients who have insurance and who want to use it by all means, but even patients with insurance, I mean, I do have a number of patients who come with coverage who still want to be here because of the level of care that they're being given. I think if I had to say my big audacious goal, I would say that Sabo is a disruptor in the space, and that we have now expanded beyond sort of our local market and sort of offering, both physicians and patients a different experience and a different model. On the sort of patient education side, my big audacious goal, if you ask me like on my 90th birthday, what do I hope I would have accomplished? I would love to change sex education in America. And I would love to shift it from pregnancy prevention to really educate reproductive education and really understanding the biology for both men and women, what's normal, what's not normal, when to seek out care, et cetera. Because I think that is a much more holistic, and not holistic as in sort of hippie woo woo, but holistic in terms of like whole person approach to reproductive education. And I do think that the more educated that we are as a society at a younger age, the more that then allows us to seek out the help sooner versus waiting the 2, the 3, the 5 years that I was mentioning at the beginning of.
Yeah. And it sounds like it would probably prevent patient visits as well, because then they're not having to ask those questions
Sure, sure,
that to you may be trivial, but that's what you do every day. But if they already
right,
have the knowledge kind of growing up, it's not a taboo topic to talk about,
right.
especially around sex education, because especially around the world, and it's handled very differently, I'm sure.
Right. And when you think about, going back to the WHO numbers of 1 in 6 people worldwide will have infertility, when your entire, let's call it childhood, you're maybe a little young, but when your entire upbringing into adolescence and into young adulthood has been all around, be safe, be responsible, make sure you're ready, make sure you're financially there, make sure you have the right setup, the right partner, et cetera, et cetera, et cetera. you don't have the mental construct around what happens if I have difficulty. And so when you do have difficulty, it's almost like this double shock to the system because you've never had to think about it before, right? So I do think that we have a long way to go when it comes to education.
Yeah. And I'm sure a lot of people think it's not going to be me. And then it happens. And then you're like, well, I never
Yeah,
thought about that alternative. What if
yeah,
it is me? You know?
exactly, exactly.
Yeah. Yeah. And as we're kind of wrapping things up here, we're at the end. Where's the best place that people can reach out to you, connect, learn more, maybe get more of that patient education as well?
Yeah, so really the best place to check out is my website, ceibofertilitycenter.com. There's a lot of information on there. There's videos of me talking. I think it's so important that you know, like, and trust your doctor before you actually, connect with them. And I'm also on social media. So I have my own account for Dr. Carolina Sueldo. I also have the Ceibo Fertility account. I have some YouTube videos. So we are across a lot of different channels and platforms, but I would say the website is probably the best way to connect. We have an inquiry form there. We have the office number there. It's definitely the best place to reach out.
Well, thank you for joining us. It was a really powerful conversation, and I'm sure people watching will get a lot out of it. So, really, thank you so much, genuinely, for your time.
Okay, absolutely. Thank you so much for having me, John. It's been fun.
Thank you.